Cervical cancer is a very common infection, especially in females above 21 years of age. Good day, everyone. I'm Gwendolyn Hale, a medical microbiologist, popularly known as the medical professional with the difference. And I bring you knowledge on health, medicals, hygiene, farming, business, and a lot more. Stay tuned. Welcome back. So today we'll be talking about signs and prevention of cervical cancer. Signs and preventions of cervical cancer. Now, cervical cancer is caused by the human papilloma virus. It's a very common virus and it comes in different types. For example, the high-risk human papilloma virus causes cervical cancer, and the low-risk HPV, human papilloma virus type, causes genital warts. So, what are the signs and symptoms of cervical cancer? Point number one, when your periods are longer than normal. For example, if you have normally a 4 days period and all of a sudden your period now extends to 7 days, know that that is a call for concern. The next point is frequent urination. This is not related to if you're drinking water frequently. This is just when your bladder is always sending you to the toilet, even when you are not drinking too much water. The next point is pain during sex. This is very common. This is one very common symptom of cervical cancer, and it is one that every lady should pay attention to. The next point is bleeding after sex. Bleeding after sex is also one common symptom or sign of cervical cancer, which every lady above 21 years of age should take note of. The next point is bleeding between periods or after menopause, and I will explain. Let's say, for example, that you have a 28-day cycle, and all of a sudden after your period, between the last day of your period to the next start of your menses in the next month, you have bleeding. And this bleeding could be spottings, or it could be bleeding that may not actually feel a regular or a standard pad. Another is when you start having spottings or bleeding after menopause. We all should know that menopause, your menses during menopause, or menstruation or periods during menopause, cut off gradually. Let's take, for example, during menopause, you start having 1 month, you will not have your period. After 6 months, you won't see your period. Then after 8 months, you see your period. Then it would go forever. But after it has gone forever, let me say like a year, you notice you have these spottings or this discharge, bloody discharge. It's a call for concern. You should see your GP. Next point is pelvic pain, an intense pelvic pain or pain around the pelvis, persistent pain around the pelvis or the back. And the next point is when you have pain during urination, when you are passing out urine and you feel pain anywhere from your navel and below, or around your private area or your pelvis. That is a serious call for concern. Another point is weight loss. You will notice that you have this gradual weight loss during these times when you're having 1 or 2 or 3 or combined or more combined symptoms that I'm mentioning. And the last symptom is you have a discharge And this discharge could be watery or bloody. Now, this is not a symptom, or these symptoms which I've mentioned are very, very common. And sometimes a lady or a girl may have one symptom or two or three, or sometimes combined. So if you have any of these symptoms, whether they come as one or two or three combined, do see your GP, run to your gynae. Now we are going to look at the risk factor of this infection, of cervical cancer. The first is if you have multiple partners, if you sleep with everyone you meet, and if you don't have protected sex. If you're somebody who carries out oral sex, anal sex, and you don't use any form of protection, whether it's a dental dam or a condom, then know that you are at high risk. Also, if you smoke, smoking actually increases the risk of a lady over 21 years of age to have this cervical cancer. The next point is if while you were pregnant, or while your mom was pregnant with you, or while you were in your mother's womb, your mother actually took any form of drugs to prevent miscarriage. That is also a very high risk factor. The next point is if you are infected with several other sexually transmitted infections. If you have other sexually transmitted infections, you are at risk of having this cervical cancer. If you have a weakened immune system, I did a video on how we could boost up temporarily boost up our white blood cells, which are responsible for protecting us, protecting our body, and fighting against infections and diseases. And the next and the last point is if we start having sex very early. For example, if we actually were exposed to sex, let me say at 16 years old, or we started being sexually active at 16, 12 years old, we are more likely to have cervical cancer. So how can we prevent cervical cancer? Point number one, practice safe sex. Use a condom, use dental dams. Look, prevention is better than cure. Protect yourself. On point number two, do your regular pap smear test. Ladies, if you are above 21 years of age, do your regular pap smear test yearly. After every year, go to the hospital and do it. And in most communities and in most public hospitals, these tests are free. So there's nothing to lose. You have nothing to lose. Instead, this is a very, 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 stubborn infection to control. This or to manage cervical cancer. And you spend a lot of money and a lot of resources and time in order to sort out or to cure cervical cancer if you do get it. The next point is don't smoke. Don't smoke. Stop smoking if you're smoking. And the last point is you can take a human papilloma virus vaccine. It does exist, and that would depend on one part of the country you are in. So it's better to be safe, and it's better to go to the doctors and do your regular checks and be sure that you are disease-free, you understand, than to find out that it has you have an infection and it has grown to us from a primary stage where it could be controlled to a tertiary stage. So ladies, please, let us be so conscious and sensitive with anything related to our sexual health or reproductive health. And we've come to the end of this teaching. So for all returning subscribers, I'd love to say thank you, and I send a big hug to you. And if you just landed on this channel or on this video, please switch on the notification bell so that you can get juicy knowledge on health, medicals, farming, business, and a lot more. And also, don't forget to subscribe because it increases the visibility of the video so that many women can be empowered with this knowledge. Thank you so much, and I remain your favorite medical professional, Gwendolyn Halle. Bye-bye.